So our first speaker this morning is Dr. James Bennie, and he's also got an interesting story. Over 27 years ago, he's had a tragic accident that severed his left knee in half. And this prompted him to sort of embark on a study of what's the best way to heal yourself. And he came out with its nutrition and bicycling. So he began reading and following people, reading Dr. McDougall. He became vegetarian because he figured, this is going to be the best way to heal. So this change not only allowed him to recover, but it led to him entering the world of competitive road cycling. And his orthopedic surgeon said, "I have never seen anyone come back from this type of injury." So not only did he come back, he came back with a vengeance. And it caused, a fascination with Dr. Bennie about the body and its ability to heal. And in 2004, he decided to attend. He enrolled in just really beautiful medical school, the American University of the Caribbean in St. Martin. And he finished medical school in 2008. Then he entered into a family medicine residency at Michigan State University. And in 2011, he moved back to California, where he entered private practice in Redding, California. That's Northern California. And then he discovered T. Colin Campbell's book, The China Study, and he learned that Dr. McDougall is treating many people with chronic illnesses using nutrition. And that people come to his program, and in 5 or 10 days, they reverse their high blood pressure, their diabetes, they drop their cholesterol, and lose weight. So he contacted Dr. McDougall and asked if he could come and observe what he was doing, and Dr. McDougall said, sure. So basically, the rest, they say, is history. He was on his way, and he took this information back to his private practice, and he was able to use it with his patients and reverse their coronary artery disease for many, help them attack diabetes, obesity, Crohn's disease, ulcerative colitis, carpal tunnel syndrome, lupus, rheumatoid arthritis, and a lot of other diseases just by having people change to a healthy plant-based diet. He was hired by Whole Foods to run be the first company physician at their medical and wellness center in Glendale, California. And after launching that pilot program, he went back to Redding, California to take on the challenging position with the Native American Indian population at the Reading Rancheria, if I'm saying that right. Is it Reading or Redding? Redding. So this is where he's continuing to work today. And he's really lucky that he's got a full-time nutritionist, plant-based nutritionist, to assist him with patient care. I mean, isn't that what patient care should be? What are you eating? Let's get you well. And so he's just up there reversing disease and helping people improve the quality of their life. He's a double board certified in family medicine as well as echocardiography. And he has worked with all of the top leaders in the plant-based lifestyle medicine field. And he's now considered an expert in the area of treatment of chronic disease with proper nutrition. And he continues to work with Dr. McDougall in his program in Santa Rosa. So it's an honor to have him and a pleasure to introduce him to you. Please welcome Dr. Bennie.
So how is everybody? Good? Is this all really new for a lot of people? It's kind of what I gathered last night. There was a lot of people. Again, show of hands, this is the first time you've ever been to something like this. So a lot of new people, a lot of new ideas, a lot of crazy stuff, a lot of crazy people like me talking about crazy stuff, eating better. What is that? Well, I had a different presentation, and after listening to some of the questions, I was up until 1, got 3 hours of sleep, and finished the rest of this. So if I seem a little out of it, but I try to gear my talks to the people that I'm talking to. I don't want to talk something that bores you. There's nothing worse in medicine than sitting down and listening to someone talk that just bores you to death. So hopefully we can keep this fun and interesting. So anyway, that's me. I got to see how this works. There we go. That was me at Whole Foods. This is about 2 years ago. I helped them start up their first wellness center. It had great ideas, but there were some differences of opinion, so I decided to go back to Redding, California. But great idea. I mean, thank God we have people like John Mackey who wants to try to help his employees with this type of thing, trying to get them to eat better and live better. We had yoga classes. We did lots of good stuff for those people. It's still in... They're still using it, and I think it's going to take on a little different direction, but we'll see what they do with that in the future. It's hard when you're the CEO of a company and you have a vision and you have to answer to shareholders. Kind of changes the direction of things. But anyway, it's great thing that they have going there. All right, so it's next year. This is Redding, California. Let's see if I can use this laser pointer. Right there is actually where I work. This is a beautiful place. We'll go through this. This is why I moved back to Redding. This is Mountain Shasta. We're going to go through a lot of these. This is what I love to do is mountain bike. This is the Sundial Bridge. Actually is a sundial. You can actually go at different times of day and see what time it is by that, casting a shadow down on the ground. But this is actually where I live. I actually used to. Let's go back. Let's see. Go back. I press back. There we are. I used to live right over here, and I live over here. It's really a beautiful place. Lots of fun things to do if you like outdoor activities. So again, beautiful pictures. That's why I moved back. This is another reason. My wife, I have 2 kids, and we love to mountain bike, and this is what I get to do every single day that I am off. We try to get out and do this. And there's not a lot of places in the world that I've been so blessed to live to be able to do this. This is Dr. McDougall. I also work with Dr. McDougall. The reason I showed this is for Don Forrester. They were talking about one of those patients. Was that the same Don Forrester they were talking? Yeah, Don. So you can see how tall I am, how Don is. Poor John, we dwarfed the guy. But wonderful, wonderful guy that has just been a light in so many people's lives and was so nice to allow me to come down and watch what he did. And I will tell you one thing is when you're a physician and you're taught to give pills to people, and then you get out and you realize pills kill people, they don't really help the disease. And then you go to a physician like this and they immediately take people off pills, like day one. Oh, you have high blood pressure? We're taking you off those medications. Oh, your diabetes? We're taking you off your insulin. Me as a physician, all of a sudden, I'm like, my sphincter tightened. I was like, you are going to do that? How do you do that? You know, you're going to kill them. You're going to kill them. I'm saying this inside. I'm just watching going, oh my God, he's crazy. Well, 5 days later, you watch all these people, their blood pressure comes down, they are off their medications, their blood sugar comes down, they feel better. Just every complaint that they have in just a matter of short 5 days changes. That completely, if you would have to be completely deaf, dumb, and blind to not see that is a powerful, powerful treatment and not integrate that into your own medical practice. So that's what I did. Not a lot of physicians were happy with me. Why weren't physicians happy with me? Here I have this great new thing that's actually been around for a while. Let's get them better. No. I started to see people that were angry with me. Angry. Why were they angry? Because in the world of medicine, if I can put you on a pill, I can see you every 3 months for the rest of your life. That's how we make money in medicine. If I put you on a plant-based diet and you get better, I probably won't see you again. So there's a lot of people, especially in a small community of Redding where I live, that get really angry. There's still some are pretty angry that I teach this. But you know what? It's not about them. It's about my patients. That's why I went into medicine. I'm a patient advocate, not a sickness care advocate. This is the Redding Rancheria. This is the building where I work. It's right downtown Redding. Those are some of the nutritionists there that we have that work with us. This is my office. Kind of a little messy there, but I wanted people to see, what I get to type into all day long. My life has turned into a data entry technician. But with that comes these things, these big computers there. If you look at that, it's a picture of Dr. McDougall's webpage. I think I have another one in here. It has a picture of Dr. Greger's Nutritionfacts.org. This is what I'm able to use every single day when my patients come in. I'm able to find out what's going on, and if there's something that I know that eating better is going to help, I use these as tools, and it gets people on board. Just me talking is just me talking. It's just lip service. But when you have these kinds of tools, and I invite you to go to nutritionfacts.org, pcrm.org, drmcdougal.com. These are great websites to really keep feeding your knowledge, because the more you learn, the more you're going to do this, the healthier you're going to be. And there's something that's really cool about that. It's not just you getting better. Everybody in society, when they get better, everybody does better. That's the large picture. There's this weird thing in America, it's like everybody has to get more and be better than everybody else. But the problem is, when you do that, you're leaving everybody else behind, and those are the people that usually hold you up when you need them most. So educate yourself, educate other people. It's a very important thing to do. And who gets the benefit out of that? You do. Society does. This is our nutritionist. He worked with Dr. McDougall. I was able to steal him away and get him to come up and work at the Reading Rancheria. One thing that's really nice is we do have a nutritionist, so when I get in there and I get out my pom-poms and I get them all motivated that they want to eat the leaves off the tree, I have to be able to give them somebody that teaches them how to eat the leaves off the tree, right? So this is a great thing that they have. They do biometrics, and we have cooking classes. We have a lot of things that really support those people. Unfortunately, you don't see this in general medicine. We are an Indian healthcare clinic. We have a lot of money to do this, and that's why we can do it. Unfortunately, in the regular medical world, they don't have that kind of money. Insurances have controlled it so much that it's really gotten to where it's a broken system. I guess that's the best way to put it. It's really sad. Let's move on here. All right. So what diet should physicians recommend? I would have recommended, who knows what I recommended, residency. I know you add whole grains and stuff, but I probably would have said, maybe a little bit more meat. But what should they recommend? What should physicians even recommend it? I think this is a good question. Well, health. What is health? It's the state of being free from disease, illness, or injury. This is what, when you go to the doctor, you want to know, but we don't usually ask that question when you go to the doctor. Hey, doc, how can I not have a heart attack? How can I not have a stroke? People don't, they're just coming from one problem. They don't know those things. So you hope that physician is teaching you how to be the healthiest they can be. And you never know when you're going to have that chance as a physician. So always try to meet those people where they are. So how do we achieve this state of health? Do you have to exercise like crazy? Do you have to meditate every day? Do you have to count your calories? You guys, I've heard all of these things that goes on. Here, what else? Do you have to eat a lot of protein? If you do, you have to eat a lot of protein. Does it have to come from meat, eggs, dairy, or plant protein? And how do you achieve this? Do you have to stay away from carbs? We've all heard that. I hear that every day, believe me, especially with all the diabetics I see. Oh, carbs are horrible for you. Potatoes will kill you. Should you take a lot of vitamins? That's always a subject of debate. But let's see. So, should you eat vegan? Should you eat vegetarian? It goes on here. Should you eat paleo? Should you eat Atkins? Should you eat DASH diet? Should you eat low carb, low fat, or in moderation? You're going to hear Dr. Esselstyn say what he feels about moderation here, if you haven't heard that. So what should we do? Like, I have to deal with this every day, and most of the people do the diet that they want to be on. They don't do the diet that is best for them. So that's why I have to hear it. Oh, I eat this way, because I love meat. But meat is not good for you. I'm sorry, I wish I could tell you that. All right, let's see. So they did a study. This was Nutrition Knowledge and Practices of Physicians in the Family Practice Residency Program, the effect of an education program. So what they did was they tested all these residency programs to see what was their knowledge, what was a physician's knowledge of nutrition. Should you be asking your physician what kind of nutrition they should be recommending? Well, what did this study say? It surveyed 258 family medicine residency programs. That's a lot of doctors. The degree of nutrition knowledge has been found to be low among physicians in practice, including family physicians. You know how much education I got in nutrition when I was in medical school? 0. Well, maybe. I have to dig for that. Residency, definitely not any. In fact, when I had a diabetic patient that I got to eat better, she got her off some of her medications, and this is what the attending told me. He said, "That's great and all, Dr. Bennie, but if you don't practice with a pharmaceutical-based protocol, you're running the risk of getting kicked out of this program." Wow. That's amazing to me. They don't want to know. They want to get you back on those pills. I've had so many doctors, if you don't start the pill process and get them on, you're never going to make money in this business. Is it all about making money? That's what they kind of were teaching me. Well, what did they do back in 1939? Does anybody know who this is? Show of hands. Wow, a lot of people. The stuff I'm showing you today is what I show my patients because I want them to see how long this information's been out there. This is not new. They've been doing this for hundreds of years, but this was when they really took it to the next level. This is Walter Kempner. He's a German physician. He went to Duke University and started treating patients with horrible kidney and high blood pressure on a rice diet. Why did they do that? Well, let's see. The kidney and high blood pressure they treated, but this is what they put those people on, was a diet of white rice, fruit juice, and sugar. And I love showing this to my diabetics because they're going to say, oh, that'll kill you. Well, it didn't kill all these people. In fact, the reason that they used this diet was because they didn't have medications back then. It's the only thing that ever showed that you could reverse those chronic diseases. So this is a picture. I love this because nowadays you can Photoshop all this. This was done before they could Photoshop. So if you see back here in 1966, it's a year later, the guy lost about 120 pounds. There's another that she lost 120 pounds off eating rice, fruit juice, and sugar. How many of you heard that's going to make you fat and kill you? Yet look at that, doesn't make any sense, does it? But it made sense to them. Fact, this is a picture of an eye. This is all off Dr. McDougall's webpage, by the way. Some of the other stuff you can get out of Duke University, but it's hard to find, and you'll find out in a second why. But this is off Dr. McDougall's. This is really nice. So this is a picture of a normal eye. This is a damaged eye from being a typical American diet. These are called cotton wool spots. It's nerve damage to the retina. This is the optic disc. You can't even see it. This is normal. So this person goes on the rice diet, and 2 years later, that's their eye. They're reversing retinopathy. They're reversing kidney disease. They're reversing heart disease, obesity, everything on stuff that a lot of people have been told that kills them. This is a picture of a person that was in heart failure. I love showing these because, like I said, you can't Photoshop this stuff from so many years ago. This is a person that's dilated heart. You can see all that. I don't know if you can see it out there, but this is pulmonary congestion. They're getting all this fluid that's starting to build up in their lungs because their heart can't pump it forward. If your heart can't pump your fluid forward, it backs up, and it's going to back up every part of your body. This person goes on this rice diet, and in 105 days, you can see here, this is their heart. They completely reverse it. I've actually had a couple patients that have done this. Sad story, good story, but sad. I had a guy that was a truck driver, ate this way. About 6 months it took on a plant-based diet, doing it hardcore. His wife had lupus. She had pretty much put her lupus in remission with this, so he was kind of doing it as a secondary thing. Heart failure, kept doing it. One day he walks in, he's amazing. He's just like, I feel great. I want my Class A license back. So he gets his Class A license back. He's doing wonderful. About a year later, I have him come back. He's the same weight and he's back in heart failure. He went back to his same diet. The power of food is absolutely phenomenal. He knew it. This also lets you understand it's not just that we know that this guy knew that you could reverse his heart failure, yet he got sucked back into the same old patterns. So it's more than just knowledge. There's so much of the psychological part that goes on that I have to deal with every day, trying to get my pom-poms out to keep encouraging people to do this. Because remember who you're doing this for. You're doing it for you. You aren't doing it for me. That's why I eat this way. I eat this way because I do it for me. The data is so overwhelmingly strong that you can live the healthiest, longest lifestyle. I do it for me. Selfish, I know. So we'll move on here, and I wanted to show you what the rice diet actual composition is. And the reason I do this, again, is my patients always have this conception of so many things. But this is the typical American diet back then. 100 grams of fat, rice diet 5. Okay, 95% reduction. That's huge. Here we go, 100 grams of protein down to 25, and they double their carbohydrate almost, 300 to 565, and they all lose weight. You should see my patients' faces when you show them this in the room. They're like, wow. I don't expect them to do this, right? It's a very strict diet. It's very difficult, but this is what I get them on board to say, add one more fruit to your plate today. Add one more vegetable. I got to meet them where they are. I never know where they are. I never know who's going to change. But if I can get them to understand the bigger picture, they'll start like, yeah, I can eat one more fruit. He's not telling me not to eat meat or eggs or cheese or whatever. He's just saying, hey, start adding more of the good stuff, because what do you do with the good stuff is you're crowding out the bad stuff. All right. Although low-tech, the benefits of the rice diet far exceed those of any drug or surgery ever prescribed for any chronic condition, without a doubt. Coronary artery disease, heart disease, high blood pressure, diabetes, arthritis, obesity. I am in a very, very unique position as a physician doing this for over 4 years in an independent practice. I've seen all these people reverse these diseases with this lifestyle. Eating healthy is so amazing. I mean, that's what, when you see somebody that comes in that was supposed to get, say, carpal tunnel surgery, they go and eat a plant-based diet and they come back 3 months later and they don't have any carpal tunnel syndrome and they don't have to have surgery. I had one patient that was actually upset at me that I wasn't even more excited for him, and I'm just standing there, and one of my nurses is in there and I said, Keith, what do you think about that? He's like, wow, that's amazing. And it is amazing. Here's this guy that just didn't believe you could do it with your diet. He doesn't have to get surgery. I've never seen anybody that didn't benefit from this. So you'll all get a benefit by doing this. So do it for yourself. So this is a funny thing I came across while researching this a little bit more. Dr. Kempner was hardcore. I mean, we're talking, 50 Shades of Grey hardcore. He believed in his diet so much that apparently he whipped a patient with a riding crop on her bare buttocks for not sticking to it. And do you see what he said on the bottom here? You read that? At Kempner's deposition, he stated he thought the risk of his patients' lives was so great that if they deviated from this regimen, that it warranted harshness. I practice a little different medicine. Although there's some patients I'd like to use that on. So this is the other interesting thing that came about. Durham, North Carolina was the diet capital of the world back then. People flocked from all over the world to go there, to the fat farm, and lose weight by eating this horribly dangerous diet. I mean, come on. After a while, you just say, what happens is history repeats itself, right? And you know who helps that? Is big ag, big meat, big dairy. They have lots of advertising dollars. If I watch anything on TV, when I grew up, and I remember, ho, 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 green giant, bird's eye vegetables, chunking Chinese food. Now all you see is fast food and pharmaceutical drugs being advertised, and you're going to have an erection lasting longer than 4 hours, too, if you do it. I mean, it's really horrible what you see, but that when people are exposed to that, they don't know any different, and so they don't have a chance to move on. Those big companies are also profit-driven. They could care less if your collateral damage is on the way. So you have to be smarter. You have to take control of your life, and you have the power to do it. Everybody has the power to do it. You just got to figure out the way, what's going to work for you. Everybody's individual. You have to be honest with yourself and say what's going to work for you and start moving in that direction. Sadly, 2002, Duke University severed its relationship with the rice diet. Why? Money. Now we have all the drugs. Now I can put you on drugs and I can make a lot of money. I don't want to get you better because then you won't come back and I can't build a bigger and more beautiful hospital. Who was it? Dr. Burkitt. Remember who Dr. Burkitt is? Yeah, right, the fiber. Did you remember he was, I think it was Uganda. He was the medical for what, he coined that term, like what he saw over there versus America, or actually is from Britain. So what he coined was big poop, small hospital, right? Small poop, big hospital. Because in Uganda, they didn't have any disease. They didn't have big hospitals because they eat primarily a plant-based diet, opposite of the U.S. We have beautiful hospitals, willing to suck your pockets dry. Our medical system is not a healthcare system, exactly. My patients are shocked when I tell them that, but that's what it is, and I'm honest with them. And I think that's, when you're honest with your patients, I think that you get them on board more, like, hey, he really is, he's on my side. He's not on that system side. In fact, I actually taught this to a drug rep once, gave her a bunch of the information. Next thing you know, she quit that job. She couldn't believe of how she had been bamboozled. So we already talked about this. I definitely am a patient advocate. That's my goal. I went back to medical school later. I'd already been doing cardiac ultrasound. It's like ultrasound on pregnant women. And it was always amazing to me. Here I am explaining stuff on the heart, and I'm doing a pre-op for, say, an aortic valve replacement or a valve replacement in the heart. These people don't even know what part of their heart is going to be replaced. They have no idea. There's been no education. And I saw there was a gap. And I wanted to go back into medicine and try to fill that gap with education. Is it difficult? Yes. Do you spend more time with your patients? Yes. Do you have to keep up on everything? Yes. Is it worth it? Yes. Absolutely. There's nothing better than watching people get better. That's why I went to medicine in the first place. There's nothing worse than when your attending tells you, don't worry, Jim. Diabetics just get fatter and sicker. Every 5 years, you add another medication till you chop off a leg, they get kidney failure or go blind and then die. You know how I felt inside? I was like, that's what I'm doing? What the heck am I here for? Oh my God. Had to be a better way. And there was. All right, so more disease equals higher cost to you, right? Who's this benefit? Right, physicians, me, right? Technically, yeah. Hospitals, pharmaceutical companies. But if you eat better and you have less disease, who's that benefit? The most important, you, your employer, your loved ones, insurance companies, especially Medicare. Now, does everybody know that Medicare pays for this lifestyle? Yeah? How many, show of hands, knows that Medicare pays for this? A little bit. Medicare, since 2011, has been paying for this lifestyle because of the work of Dr. Ornish. Dr. Ornish in 1990 showed you reverse heart disease on a plant-based diet. I worked in cardiology. I even asked my cardiologist friends, this is pretty amazing. Don't you think they'd want to do it? They'll never do it. It's good work, but they'll never do it. Let's see. Saw to the chest, crack it open, strip a bunch of veins out of your legs, put them back in your chest, close that up, or spinach. My guess is somebody would pick spinach and potatoes and that kind of lifestyle versus the knife, but I know people that would rather have the knife. I have patients like that. But, yeah. Well, here, let's go. So it pays for it, right? So here we go. If you have documented heart disease, Medicare will pay $7,200 if you're part of the Pritikin program or the Ornish Spectrum program. Why does it do that? Why does it want us to teach plant-based? What's the benefit? You're already getting there, right? You know what the benefit is. It's all cash. It's all cash. Because if you can stop one stent, save 80 grand. One coronary bypass, $300,000 to $500,000. Well, who benefits from that? Medicare. Remember, they are in a fixed income. They can't increase your premiums like other insurance companies. A little bit of comes out of your check every couple of weeks, right? They take that. If the more that they have to pay out, the more money they lose. The more that they can keep, the more money they keep. If it happens to be to your benefit, good for you. Win-win. But that's not why they're doing it. At first I was like, oh, finally, they see the light. They're so smart. No. As you see, it just came up here. If you stop all that, they can save billions, trillions of dollars. It's all about money. But if it's to the benefit of us, good. For once, good. Well, let me do a caveat here. To be part of this program, as we've looked at doing it, we have to fork out $500,000 to be Ornish certified. That's a lot of money. So until some magic Santa Claus comes at Christmas and drops, a lot of money in my lap, I don't think we're going to be doing that. But I want people to understand that there's value in that. And if you understand that Medicare is doing it and they're saving money on it because it does save disease, that's a powerful motivator. Like, hold on, that's a big deal. Maybe I should eat this way. Who cares if I'm going to get paid? My doctor gets $7,200. It makes me better. I don't get any of that money. I just get whatever I get paid, which is not that much. All right. It's because of the work of Dean Ornish, which has done so much amazing stuff, and Caldwell Esselstyn, that President Clinton turned vegan. Now, this was fascinating to me. This is what really got me to look, because right after I got out of residency, I heard President Clinton went vegan, and I'm like, oh, all right, you have a really intelligent guy that has all the money, has many chefs as he wants, can eat any way he wants, and used to, because I remember he'd be running on his run. He'd run right to the McDonald's and then run back to the White House. I remember those days. I'm like, hold on, so why would he change? So there had to be something powerful enough to make him want to change. That brought me to the China study, and I read that, and we'll talk about that in a second. But anyway, he had a quadruple bypass in 2004, had some brain damage from the hypoxia. It's very, very common to have that. And then he kept eating the same way, and in 2010, he had 2 more stents. But after he started reading all this, he's back to the same way he was as a senior in high school and healthier than ever. And you know why he did it? I tried to put this on last night, and I couldn't figure out, I was half asleep trying to do this, but this interview is phenomenal. This is Bill Clinton and what's his name? I'm really tired right now. There you go, Letterman. And they both have zippers in their chest, right? They both have had bypasses. And this is back in 2011. If you guys want to pull this up and watch it, he talks about the information and why he did it. And the main reason was this. He says in an interview he wants to be alive to see his daughter have grandkids because he knew clearly that the way he was eating was not conducive to a long-term life on this planet. And then when I saw that picture, it all flashed back to me. I'm like, yes, right on, good for you. That's awesome. That's what we all want. We all want to be around longer to watch our kids have grandkids if that's what we have, or do more things on this planet. I mean, you're here for a very short, brief time. To me, why not experience and do things that make your life enjoyable? I would hate to be like some of the patients I see that get wheeled in a wheelchair and they're edematous and they're so sick. I mean, all right, quality of life is an individual issue, but I don't see how that's a really good quality of life, is being that sick. That's why you do this. You know him. The reason I'm showing this, and not to steal anything from Dr. Esselstyn, I'm sure he'll show this, but the power of a plant-based diet, I show this to my patients. That's why I show you. This is what I use every day so they can get it. Is this was a cardiothoracic surgeon that had a heart attack. It was about 30 years ago, I think. And they reversed his disease. But I want you to see all of the other arteries that are open that weren't open here. The reason I bring this up is I tell people, this is not just about heart disease. This is vascular disease. This is brain disease. This is big toe disease. This is erectile dysfunction disease. This is every kind of every chronic disease is vascularly related. If you can reverse it, oh my God, that's phenomenal. And that's why we see all these things. All these patients that I've had that do this, they get the benefits. Their whole life gets better. One, I was giving a lecture to a bunch of retirees, and the end of they were asking some questions, but a 73-year-old guy stands up and he just want to tell you, I've been doing this, and I know it seems difficult, but it's been great, but I want to tell you, the flag still rises. I mean, at 73, that you can get some quality of life back. That's worth it, isn't it? A way to reverse heart disease. The reason I'm showing this is because this one, and I know it's long, but this is important. In summary, the present cardiovascular medicine approach tested beyond 40 years can neither cure the disease nor end the epidemic and is financially unsustainable. That's a powerful statement. It's what we're doing with our current system does not work for people. Works for keeping your bank account big if you're a hospital, but not for people. The safety, diminished expense, and prompt, powerful, and persistence results in treating the cause of vascular disease by whole food, plant-based nutrition offer a paradigm shift from existing practice. And we think the time is right for controlled trial. Let's skip that. But in the meantime, the data are sound and strong enough that patients should be informed of this option. That's what I'm doing. You need to be informed. If your doctor's not informing you, try to inform yourself. Go to those websites that I talk about. They're very credible websites. What I use every day. I fact-check them just a gazillion times. Important stuff. This was just published a couple years ago. I don't know, it's a couple years? I think it's a couple years ago. Fantastic information. And when I show patients this, it reverses heart disease 99.4%. Absolute risk reduction of statins is 5%. When I tell that to a patient, do you think they're going, oh, it's so bad? No, they're going, oh my God, like really? So yeah, I'll give you a medication, but it's only slowing the progression. It's not really going to do much for you. This reverses it. We've never had that before. That's phenomenal. All right. What does this doctor say about eating this way? Well, that's Dr. McDougal back when he was in Hawaii many, many years ago. He's been doing this for 40 years, still teaching the same thing. He hasn't changed. He doesn't sell more supplements. He doesn't do paleo this week and Atkins that. And it's the same thing, whole food, plant-based diet. Just a pillar of strength in the plant-based world. Just phenomenal, phenomenal human being that has been great to so many. But so back to what should a physician recommend? Maybe I should recommend what I've seen that people reverse constantly, all the diseases. Go with the people that are blazing the trails for a lot of years. I love this. There's this old book. That's one of the first books I ever read back when I had sliced my knee in half. And reading that, I thought it was a little strict, right? Come on, I can have egg whites, can't I? Yeah, it was a little strict. But you get older and you wiser and you figure out a lot more. But I think it's great. And this wonderful book, if you guys want a great read, I'm not just saying that. The Starch Solution covers everything. And I think it does it very, very succinctly. And it does it where you feel good about the information you just heard. It's like it doesn't leave anything untouched. And the last third of the book is recipes. So when I stand up here talking, I'm not doing anything new. I'm just re-educating, bringing back the past and showing we've been doing this for years and trying to keep that steamroller going forward, because if we don't sit up here and talk about these things, we'll just go back and do it all over again. And all of society suffers for that. There's a picture of his website, wonderful website, lots of stuff on there. Please, one thing I also like too is Star McDougallers. And the Star McDougallers are people that have reversed their own diseases. So you can see people that may have a disease like you have, and you can see that what's happened with them. I've just never seen anybody that didn't get better doing this lifestyle. But it's great resource, lots of good. And to subscribe to his newsletter is always talking about something pertinent that's in the media. Another great website, Nutritionfactsorg, what does he recommend? What's the science recommend? He makes it look like he's not recommending anything. He's just trying to present the data that shows eating a plant-based diet reverses all your diseases, and it does. Great website. Does anybody know Jeff Novick? Dietitian extraordinaire, phenomenal guy. In fact, when I was back, I was at McDougall's last weekend. I was telling him, he's like, so how many people do you get to change? I said, you know what, Jeff? I just give them the information. I just try to meet them wherever they are. He gave me a high five. He goes, I feel like grandpa that just got his kid to understand, you can't just ram plant-based eating down people's throats. You have to meet them where they are. I have to keep presenting the information. You have to be supportive. Great guy. You all know him, another wonderful guy doing a lot of great work, another great resource. A lot of the stuff I hand out to my patients are their education materials. It's vegetarian starter pack, and there's a power plate. They're great things. My patients are always happy because it gives them really simple things, what you should eat for breakfast, lunch, and dinner. What should you eat when you're on the go? Give them simple things to make those changes, and it makes it much easier on them. You know about the China study? I think this is great. The reason I'm showing you is, what did Colin Campbell figure out? Colin Campbell figured out that, dairy isn't the perfect food, that stuff kills you. And there's what Dean Ornish says about it. And I love this. This is what I used to show to my patients in my traditional private practice when I worked there. I said, this is one of the most amazing pieces of work ever. And what does the guy who got Medicare to start paying for eating a plant-based lifestyle to reverse heart disease say about it? Everyone in the field of nutrition science stands on the shoulders of Dr. Campbell, who's one of the giants in the field. This is one of the most important books about nutrition ever written, and reading it may save your life. Powerful words from a guy that's got Medicare after 16 years of review to finally hop on board. Good stuff. Tough read, but good stuff. So if you want to delve into it, but that book changed my life. That's where I read about Dr. McDougal in the back, gave him a call, and as I said before, the rest was history after that. So what does the largest healthcare in the United States recommend? You know what the largest healthcare system is? Kaiser, right? You know what they recommend? Some of you probably all know this right now, right? There they go, Thrive. What do they recommend? A plant-based diet. Why? Because it reverses all the disease, saves them lots of money, that kind of stuff, and you'll see that here. Nutritional plant-based diets, I'll skip over this, is just, that's what you should recommend. But why do they do it? Their employees become healthier, they have less sick days. Do I have to keep pressing? I don't know, I've clicked on here. Become more productive, have better moods, which creates a better working environment. People love working with me. I'm a pretty happy guy most of the time. I try to keep it that way. And definitely plant-based nutrition helps that. Feeling better after I eat lunch and not in a food coma is a big, big step in the right direction for making my employees happy. The healthier employees, the more money you're going to save. There's no doubt about it. We're going to move here. It's all about the money, isn't it? Okay. We're not moving. There we go. So back to this. What diets should physicians recommend? You guys know where I'm going with this, but what should the physicians recommend? Well, it depends, right? Depends on whether you want to sell pills or teach wellness. I love that picture of Gregor. It's hilarious. Hit you with my broccoli if you don't do this. But yeah, it depends. And there's docs that do this. This is important because when I first went to work for the Reading Rancheria and I started teaching this, I had one of the assistant medical director come up to me and sit me down in the office and tell me that I couldn't say that there was pus in milk. I said, yeah, I can. He's like, well, what's pus? I go, well, it's somatic cells. That's white blood cells and bacteria and debris. And he's like, didn't know what to say. And I said, it's my medical degree. I'm going to keep telling them that. No pus in almond milk. Sounds like a better choice, unless you like pus. But he was trying to intimidate me, and this is why he tried to intimidate me. And he knew he couldn't, because I just know this too well, and I've done this long enough that you aren't going to push me off my broccoli pedestal. That he put his arm on my shoulder when we were leaving, and he said, you know what, Jim? Just remember, those sick people pay our bills. Yeah, that's real. It's real and alive. There's a fear that if you get all these patients better, that those doctors won't make any money. I had a patient who had atrial fibrillation, which is an irregular heartbeat. They had high cholesterol, high blood pressure, a bunch of other stuff. They go on a plant-based diet. Everything gets better, even his AFib. I was shocked. I hadn't seen that. I was like, wow, heart rate's normalized? This is amazing. Goes to his cardiologist. Cardiologist says, this is phenomenal. You've reversed everything. You're off all your meds. What are you doing? He's like, well, I'm going to see this crazy doctor. No, he said, I'm going to see this doctor, Dr. Bennie, and he's put me on this plant-based diet. He's like, that's awesome. But he said for the next 30 minutes, he sat and complained about how he was not going to be able to make enough money with doctors like me in town. What a warm reception I got. And there's still some that are really pretty upset that I'm there. I've heard some pretty nasty comments coming back from patients. But yeah, so what? I'm a patient advocate. I'm not your good old boy club, right? So what do we have? And by teaching wellness, yeah, this is everything that I get to see. I reverse heart disease. I've seen that. I've seen people reverse their diabetes, reverse cancer, lower their cholesterol, obviously, lower their blood pressure. This is stuff I do all day long. It's great to see it when people do it. They're autoimmune diseases. When you have people, I'll tell you about my youngest patient I ever had, 9 years old, horrible Crohn's disease, was pooping blood all the time, had to be homeschooled because he couldn't go to school because he's pooping blood all the time, was on lots of prednisone, actually went to a pediatric GI doc down at UC Davis in Sacramento. And the mom was like, well, you know what's really interesting is she offhandedly said, read the China study. Well, for a patient to read the China study, I mean, that's a hard read. It really is. So I said, well, why don't we do this? Why don't we just get you to stop all the dairy? Let's get you to stop as much meat as you can. So I should have put pictures up there. She sends me pictures of him. 9 years old, is now like 14, and he's in all this, a straight A student, back in normal school, excelling in life, hardly ever has Crohn's outbreaks. And one of the coolest things is that one of our pizza places in town actually made a pizza after him called Joshua's Pizza that's completely vegan. It works. I mean, it's phenomenal when you see the autoimmune diseases. These are people that are basically like, oh, I hope we can make it without cutting all your bowel out by the time you're 15 and giving you a colostomy bag where you poop in that and clean that up all day. Not an option, right? This poor child, I mean, gets his life back. Very important stuff. Lupus, rheumatoid arthritis, fibromyalgia, multiple sclerosis, prevent and stop early dementia, and that's been a big hot topic. I heard the other day on the radio, come out and help us find a cure for Alzheimer's. Like there is a cure for Alzheimer's. It's not giving you money. It's teaching people to eat. It's a vascular system. That vascular system needs to be open. If you want blood flow to your brain, you need to have the open tube. If you don't have an open tube, you can't get the blood flow, which sets up all the things for the beta amyloid plaques and neurofibrillary tangles. That's where all the researchers push them. So it's all back to your vascular tree. Open it up. Eat good food. Bottom line. I want to tell you a rheumatoid arthritis story. I like doing this because this is the range. So I had 9-year-old Crohn's. I have a 93-year-old with horrible rheumatoid arthritis came to me, came in a wheelchair, couldn't shake my hand. His hand was all swollen and red. His ankles were swollen and red. He was just miserable. And his son brought him to me because he knew I was teaching plant-based diet. And so I knew I had an in. He's going to cook. He already said, I'm going to cook everything, but they got to hear it from you before they're going to eat this way. So he couldn't even shake my hand. And I said, well, you know what? I'm going to make you a bet. I bet you $1,000 that your hand is better in a month. And he's like, really? I said, no, I can't make that bet. He said, why? I said, because you'll lose. You will lose. I guarantee it. Because I already had the in. I knew he was cooking for him. A month later, it comes in. All that redness is swelling. Now, he still has damage from the rheumatoid arthritis, but he's able to shake my hand now. His redness and swelling is gone. Same with his ankles. Let's fast forward 6 months. The guy's walking in on a walker. A walker. Okay, this guy couldn't shake my hands. He's on a walker? Phenomenal. And his son told me, you know what, Dr. Bennie, I should have never brought my parents to you. You know why? I said, why? They're better. Now they're too damn cantankerous. No medication given for a chronic disease ever stops or reverses that disease. It only slows the progression at best and suppresses the symptoms of that disease. If you are having a disease, it's a manifestation of your body being sick, and giving you a pill to suppress those symptoms does not make it go away. It's the food. You have to. Your body will heal itself. It will heal itself very rapidly, but you have to give it the fuel to do that. This is another thing I tell my patients. Am I doing okay on time? I hope. You're born with a Ferrari. That's why I tell people, I point at their body. I said, you were born with a Ferrari body. It's an incredible machine. It'll do amazing things. If you give it Ferrari fuel, it'll keep doing those amazing things. But if you give it jalopy fuel, you end up with a jalopy. But in the real world, if you have a jalopy, it doesn't self-heal itself. And what's amazing is you can take this jalopy fuel that you've been feeding your body, your Ferrari body that's now turned into jalopy, and give it back to the Ferrari fuel, and it'll reverse a lot of these diseases back and give you your life back. Phenomenal stuff. People get these simple little things, but it's true. We weren't born with high blood pressure. We weren't born with diabetes. We weren't born with Crohn's disease. We weren't born with all these chronic diseases. Those are things we get from our lifestyle. And if you haven't followed what I have taught, I will be forced to give you medications and try to slow the progression of your disease. Because I have a medical legal thing too. If I don't put you on these medications and you're non-compliant, or at least document that I'm trying to put you on these medications, that could be a bad thing for me in the future. But if you build relationships with people, that usually doesn't happen. They know where you're coming from. They know that you're on their side. They know you're working in their best interest. Usually. A low-fat, plant-based diet has been shown to prevent, stop, and reverse nearly every chronic disease. Every single one. Gregor's done multiple, his year in review, every time you watch those, top 15 diseases, all of them reversible, except dying from accidents. Every single one. It shouldn't even be a question anymore. Eat this way for you. To change your health, though, you must be an active participant in your health care. If I give you the information and you say that's great and you go home and eat bacon and eggs, you're not an active participant in anti-health care. I mean, you're putting yourself down the tubes there. But this is so important. You have to figure out a way that makes it easy for you. You've got to be part of that health care. You're your own best advocate. If I miss something, you got to tell me I missed something. I'm so busy that I miss things all the time. And you're like, oh, should have remembered that. You have to be proactive when you go to your physician. If you think that they're missing something, ask them a question. If they get pissed off at you, fire them. You'll see that here in a little bit. Just get rid of them, right? Look at us like contractors. You hire them to do a job. They're supposed to be helping you, facilitating your wellness. And if they don't do that, you can get rid of them. And this is the other thing I tell my patients at Dr. McDougall's, because it's very hard. We treat patients for a select amount of time. Then they go back to the real world. Get on the phone. If you can't, find an office, any office, call them. Do you have any vegetarian doctors? Do you have any vegan doctors? You just ask the receptionist. They'll know right away. And that's the way you can figure it out. I mean, it's hard because they don't advertise it a lot, and you don't know if they do that. But if you can find people that are at least eating a healthier way, they'll understand it, and they'll usually support you. They may not be comfortable with taking you off medications, like I wasn't comfortable in the beginning, but then you learn that it doesn't make it's much better. But we're geared and we're taught to force medications down your throat and keep them there. And if you take them off, we're afraid we're going to get sued because we took you off the pills. So you've got to give some of the doctors a little credit, but if they're going to work with you, definitely try to facilitate that. You have to be there. You have to be helping some of these guys and ladies do this. All right, so I know this is kind of parody on the highly effective people, but I did this on purpose because these are the things I see. The people that are the healthiest, this is what I see in my patients. Number one, the most damaging thing you can do to your vascular system is smoke. Now, I have a lot of people that smoke, but not cigarettes. Where I live, marijuana is rampant. The Indian culture, it's rampant. In fact, I think I only had one person I've ever drug tested, that was negative for THC. It's very rampant through there. But I had this guy comes in, he just had a stent. He was still having chest pain like a month later because he's smoking a bunch of pot. So here I am with that little computer pulling up how to make edibles, how to use a vaporizer. I don't know. I'm like, anything, just don't smoke. Dude, you just had a heart attack. Come on. Seriously, so you have to meet them where they are, right? You have to be willing to throw all your preconceptions, your ideas, whatever your ilk is in life. You have to push that all aside and try to meet them where they are. And if you can do that, then they know, hey, he's really trying to be on my side. Yeah, just any kind of smoke damages your lungs. So I had to put a comedy in there, right? You've seen this before, but if you think with your penis thinks you should stop smoking. I love that. You gotta laugh a little bit. The second most important thing, so if they're still smoking, they're eating a plant-based diet, it kind of nullifies the effect. You just don't get much benefit out of that. I do have patients that do that, but they aren't getting far. Eat a low-fat, whole food, plant-based diet. Eat 3 meals a day. I can't tell you how many times I get people coming in, they're skipping breakfast, and there's a reason it's called break fast. Do I have that on there? Break fast. Your brain needs sugar. If you don't give it sugar, it's starving, and it's not happy, and you're not happy, and you're grumpy, and your energy level's down, and you don't perform well. This is the first thing I ask. What do you eat for breakfast? It's the first thing I ask so many people. I don't care what lunch or dinner. What do you eat for breakfast? They're like, oh, I skip breakfast. Why do you skip break fast? You were just fasting. Your brain needs sugar. Why are you? So they get it. I'm funny with it, but they get it. And every time they come back, just doing that simple little thing, all of a sudden their energy's up through the roof. And they're usually eating something, even if it's Quaker instant oatmeal, that's much better than bacon and eggs, right? So don't be afraid to use that too. 3 meals a day, constant supply of glucose. You gotta have that glucose. That's why I always crack up when people are like, I can't eat carbs. I'm like, hold on, that's the only thing your body uses for your energy source. So it'll use the other things if it has to, because you've been feeding it so badly, it's going to try to stay alive. But this is its primary energy source, is carbs. 30 minutes of cardiovascular exercise at least 5 days per week. Just walking. You want to do more? Great. More is better. But just walking, getting out, smelling the air, being outside, doing something physical. If you want to do push-ups, yoga, there's so many ways. But your body is a very dynamic being. It will adapt to anything that you throw at it. So if you throw the chair at it, you're going to adapt to be a couch potato. But if you throw weights and other things, you build your bones, you build your muscles, you decrease your risk for all those kinds of things like osteoporosis, osteopenia. One of the biggest things with elderly people is risk of falls. That's because they aren't getting out and exercising. You exercise, you get more balance. You got to exercise. Does not have to be hardcore. You're doing it for you. There's so many times I get up every morning. I should have put a picture in here. I have like a little gym in my garage. It's at 4:35 in the morning. I'm up and I exercise. And there's some days I'm like, I don't want to do this. Why do I subject myself to this in the morning? So I get out there and I put my cycling shoes on. I get on my trainer, and within 5 minutes, I'm like, this is why I do this. I'm already feeling better. And after I do a half an hour of that, I feel freaking phenomenal. I really do, every time. And I'm like, God, why does my brain always try to not do that? But then when I do it, I feel great. That's the challenges that we all have. I have that challenge too. But I know that if I do it, I get the benefit. And then I go to work and my patients are happy because I've already taken care of myself and I'm focused on them. I'm not thinking, I should have worked out today. Just talk to the hand. I've had enough. I can't listen to your problems anymore. Didn't work out. I'm feeling pretty tired. Oh, it's funny. Drink water. Eliminate soda. Water, water, water. Your body's 66% water. Drink water. The planet Earth is mostly water. Drink water. It's your best source. Can you have those every once in a while? Yeah, but drink water. Water, water, water. I can't stress that enough. I drink so much water during the day. You got to drink it. Your body, especially in the world of cycling or anything that you get up to competitive athletics, you become dehydrated. Your performance goes way down really quick. And that's the same when you're sitting in the office. You don't feel it as much, but all of a sudden you got a little headache, got a little bit more eye strain, you're not feeling good. Got to stay hydrated. That's an important thing. Oh, I forgot I put that in there. Happy people. If you drink alcohol, make it no more than 2 beers or a glass of wine. If you don't drink, don't add that to your diet. It's not something that I recommend, but if you do drink, try to keep it to this. This is, I remember reading an old cardiology book and looking at the damage of alcohol, but the first shot of 1 ounce of hard alcohol actually decreased your risk of heart disease. 2 put you back up at baseline, and then it just got worse after that. And when I say heart disease, it's more like heart failure. They don't usually die of heart attacks, but it can be really damaging to your body. I didn't get this last night. I'm running on empty. 7 to 9 hours of sleep. I was like, wouldn't it be nice if I followed my own advice? But seriously, it's so important to get that sleep. I get a lot of people that come in, they're fatigued and tired, and you find out they're only getting 4 or 5 hours of sleep. They're stressed or something. I have to work on trying to get good sleep time, taking TVs out of the room. A lot of people have TVs. Oh, I go to bed, I turn on my TV, I watch it till I fall asleep. How do you get restful sleep when something's going rah, rah, rah in the background? You don't. You need quiet, good, restful sleep. You always feel better. Anybody not ever felt good after you got a good night's sleep? Come on, raise your hand. I heard that. 1? Oh. It's rare. It's like the one person that ate a French fry and it benefited them. I'm looking for that person. All right. This is an important thing. I use this probably more than anything, is being in the now, being present. When I'm present with my patients, I'm very focused on them. That is healing. But it's with all human beings. If you're talking to somebody and they're on their phone like my kids do, and I have to grab the damn thing and say, hey, I need eye contact here. That is not conducive to healing. You got to be present, and that's for you at all times. You're supposed to be present what you're doing. I'm glad you're present right here and you're thinking about this. Be present. You get more out of it. If you did that in school, I learned this a long time ago. I was told a long time ago, I think it was Kevin Trudeau, I think went to jail or something, right? But be focused on this thing, mega memory. If you're focused on what your teacher is saying and you're present that whole time, you'll do so much better on tests. You know what? He was right, because you remember. If you're in your class, your teacher's blabbing, and you're scribbling, drooling on your hand because you fell asleep, it's not being present. So this helps people more than anything. Learning to stay very present, very focused. It is a powerful healer. I do more psych counseling than anything by far in my population of people that I see. And I have to really get people to stay present, because life has a way of pulling people away from their center. And once that happens, there's misery. I think it's always, and this is one of the other things I tell people. I said, look at your body. Your body can only be in the present moment. But your mind has an amazing ability to stay stuck in the past, fantasize about the future, and completely miss where the body is. So it's very important if you can stay, it's not that you can't think about those things, but to dwell on them is detrimental to your well-being. Very, very important. I just put that up there so all together. So these are some of the patients that I have had. I have a bunch of them. There's so many. But this is one I wanted to show because he was a dentist, and this is a sad case because this guy reversed his heart disease, and he had a severe aortic valve problem, and he had to have it replaced. And he tried to do a very extreme plant-based diet to see if we could reverse aortic valve disease. Doesn't work. I didn't think it would work. It didn't work in him. And when he went down to get his valve replaced, they did a 3-way bypass, and he didn't need it. That was wrong. Because now it's a headache. Now you worry about those veins collapsing. It's a whole. I'm not going to go into all that. But great guy, ex-Green Beret, really neat guy. They're kind of. This is him before and after. You know, he's a dentist, and he came to see me, and I said, "Man, you're not looking too well. You got a lot of problems here. Why don't you do this?" Let's see. Did I put his numbers up here? I did put his numbers up here. So here's his total cholesterol. Not very high. 160 total is not real high. But he already had heart disease. So it's not about, I didn't even get into that. It's not even about numbers anymore. We just know it's about what you eat. I have very high cholesterol. Eating is the critical key for me. If I eat poorly, I have to be honest with myself, I'm a really high risk of heart disease. My dad had his first heart attack at 47, second one at 52. I have bad risk. So I need to eat well. He needs to eat well, but we used to think that, oh, well, why do you need to eat well? Your total cholesterol is 160. He had vascular disease already. Some people would say that's not even that bad. These are some other numbers. Look at the weight. Let's see what we got here. Then total cholesterol in just a month and a half, look, it goes to 136. Dr. McDougall's, I'll show you one in there. It's in 5 days, we have even bigger changes. But remember, we're controlling the food at McDougall's program. Somebody has to do this on their own. So this is still really fantastic. He was able to have a 15% drop there. Lost 10 pounds, just keeps it up. Cholesterol doesn't go down, but he drops some more weight, as you see that. And now all the way down here, he's lost 50 pounds. His cholesterol is really low. I mean, this is what a very typical thing was, the 132, 74, pretty much stable there. So people get the benefits out of this, and I didn't have him on a statin. Did not have him on a statin. Scary stuff for someone. This is another patient I had. He came in with small bowel obstruction, a surgical emergency, sent him over to the hospital, and then we put him, after he got out of the hospital after multiple surgeries, went on a plant-based diet. He had all these weird things, skin rashes and stuff after the surgeries. He had like all this autoimmune disease that he'd never had before. So plant-based diet. So this was his wife, and she did it to support him. She lost 31 pounds just supporting him, and we're talking, I don't think they were strict vegan. They're eating pretty good. But yeah, this is anybody. This is anybody in the USA. You can all do this. It's to your benefit. What's it say there? It says 6 months on a plant-based diet and exercise 20 minutes a day, 5 days a week. Her body pain was gone. Energy level off the charts. Worked 2 jobs while trying to pay off Bruce's medical bills from his bowel surgery. And she noticed that when she ate sugar and meat, it would cause her arthritis to get worse. She said, I made the change for him so he would get better, but she was the big winner. We're all big winners. That's why I love to see this. I mean, these people are just so overjoyed that they're feeling better. This was a patient, this is a random one, but this is one of the patients I just had at McDougall's immersion last week. And the reason I'm showing you this, I don't know if you can probably see, I do zoom in on it here. This is the total cholesterol, 180, and in 5 days it went to 130. LDL of 108, 76. This is pretty typical. 30 to 50, 30 to 60, thank you. 30 to 60 is typical for a drop of cholesterol. But importantly, this is a really interesting story. She came in and she was telling me it on the flight over, and she'd been having chest pain. Well, that doesn't mean a lot, but when her mother died at 42 from a heart attack and she's 37, and the pain is really a pressure that's underneath, kind of radiates up into her arm, it's cardiac. It's cardiac until proven otherwise. She's at really high risk. Blood pressure is really high. Look at her blood pressure, 181/119. She's on one medication, really concerned. Best place she could ever be in the whole world is at Dr. McDougall's program. I guarantee it. I would bet my life on it. I'm like, I'm so glad you're here. But I told Dr. McDougall about it and just said, keep an eye on her. We changed her blood pressure medication to a different one's longer acting. All right, so here you go. 181/119. First day. Second day, 170/121, 154/108, 125/94, 119/84, 128/96. 5 days. It's like a miracle, isn't it? I mean, that's plant food. Now, are we reversing the disease that she has in there? No. What we're doing is the arteries have an amazing ability to dilate up, but all meat and dairy stops that ability, meat, dairy, and oil. Stops the artery's ability to dilate up. It keeps it clamped down. So once you stop putting those inflammatory foods in there, the artery naturally dilates back up, and all of a sudden they stop their chest pain. It's phenomenal. She gave me high 10s at the end of 5 days. She's like, oh my God, this is awesome. I mean, why wouldn't I want to keep doing this? It's phenomenal to see this. So, you want to eat this way? It can be challenges for sure. This is some buying tips. Buy what's in season. I've had people, with all due respect, Dr. Bennie, you're really rich. Not even close. I got way too much school debt to ever be rich my whole lifetime. You can afford all these expensive foods. I said, I eat a third world diet. I eat beans, rice, potatoes. I eat really cheap. I buy the cheapest stuff. Anybody know what Winco is? I shop at Winco. I shop at Goodwill. I really do. I'm frugal. And I can eat this way and eat very healthy for very inexpensive. So it does not have to be really expensive. You don't have to have a professional chef. You can do it. Hope you like Mexican food. This is pizza. This is food that I make at home. My wife actually made the crust. We have actually other stuff that we buy pre-cut, but this is work, okay? You can do this, but this is hours of work to create your own dough and do that. Now, if you have somebody who stays home and does that, that's great, but my wife works too. But this was just, there's ideas, right? You can buy pizza crusts that are plant-based, and you can add stuff to the top. This is some quinoa, some vegetables I made for lunch. Real quick, stuff you can make on the weekends and then have, just throw it all together, heat it up really quick. This is a local Mexican food restaurant. This is what I'll order. Is that perfect? No. We can sit there. I'll bet you there's some butter on that or chicken broth. But this is all whole pinto beans. Is there salt on it? Yes. But, I have to be able to eat and function the rest of the day, and I can't always do perfect. And that's a relative term. But anyway, you can go to any Mexican food restaurant and get these things. I put salsa on there, and I get corn tortillas, and I put all that in the corn tortilla like a little taco and a bunch of hot salsa like habanero sauce, and it'll fill you up. A whole plate of food like that, you feel great, and you don't get a food coma. This is you got one of those, what are they called? Mongolian grills. You go up and pick up everything. You can do that too. Is it perfect? No, because you know that they just grilled a bunch of nasty salmonella on it right before it got to yours. Hopefully the grill was hot enough. Luckily, I was unscathed when I came out of there. But you can make better choices, is my point. You can make better choices when you go out to restaurants. This is a salad I made the other night. My wife was like, I just want a big salad. I'm so sick of Mexican food. Let's make a salad. So, I just kind of threw everything in there. Is it perfect? No. Oh, my God, heaven forbid, I have candied pecans in there. You can see them right there. See that? Oh, they're so good. But there's fruit. I add fruit to that, too. There's mandarin oranges and strawberries and a little bit of avocado. So you make it fun. But it's work. This is Dr. McDougall's program. This is what I get to eat for lunch. That's a hummus sandwich. It's just baked potatoes with some marinara sauce on it and a little salad. But you can go back 3 or 4 times if it wasn't enough and really make yourself sick. It's just like here. You can eat, if you notice, you can eat as much as you have to eat. You're probably already starving for lunch already, if you didn't. All right, so now you're so excited you want to eat the leaves off the tree. The reason I put this on here is I had a patient that actually said that to me. She actually said it to my wife. It was just funny. I was so excited after I saw him. I wanted to eat the leaves off the tree. I just thought that was funny. Word of caution. This is important. Hopefully I have enough time. I'm going to try to rip through this. If you're on blood pressure medication, this is one weakness I see in a lot of these lectures. We don't talk about the 2 most important things is blood pressure and diabetes, because those are the things, if we don't watch your medications, they can be problematic. So, find a physician or medical provider that is familiar with using a plant-based diet for treatment of your chronic disease. If they're not familiar with eating this way, then tell the medical provider that you would like them to closely monitor your progress. Remember, you're trying to get them on board. A plant-based lifestyle will lower your blood pressure. So, if you're on blood pressure medication, it may lower it to the point that you start to become lightheaded or dizzy, especially when sitting or standing up. I shouldn't recommend this, but if that happens, you call a physician. If they aren't willing to take you off the medication, you're going to have to wean yourself off. But that's important too. Monitor your own blood pressure. Remember, you are your own best advocate. You have to take control of your life, and you have to be willing to maybe take a little risk if you're doing this, if the physician won't do it with you. If you find you're getting very low blood pressure, this gets into a little bit more heady stuff about what the numbers are, trying to monitor that. But really just think about the dizziness part. If you're starting to get lightheaded and you're on a blood pressure medication, it's over-controlled. That needs to be adjusted by a provider. Try to find one that will do that. If you cannot find a provider, you'll have to discontinue the blood pressure medication or end up blacking out and damaging your body, so you must monitor your blood pressure. A low-fat, plant-based lifestyle will also lower your blood sugar, all right? Many diabetic medications lower your blood sugar as well. They may lower it to the point that you start to become shaky, lightheaded, dizzy, and this can and will kill you if you aren't careful. So you must monitor your blood sugar. I have patients that have diabetes that never do this, but they aren't on plant-based diets, but they don't do that. But I've seen people get their blood sugars too low. Very, very important. I don't have enough time to tell you another fun story about that, which is really kind of neat. So it's very important you have a medical provider to manage your diabetic medications and take you off the ones that lower your blood sugar as well. If your provider refuses, fire them. I had a patient that actually did that. Their blood sugar was really low. The provider refused. Luckily, they came to me. We got them off the medication. This is going to kill them. Then hire a new one that is supportive of your lifestyle. Remember, this is your life we are talking about, not theirs. So this is an important video. If you guys have diabetes, anybody in this room, you must watch this video. It is life-saving. It's what I teach all my patients. All my patients watch this 6-minute video. It shows you that fat is the root cause of diabetes. The mechanism of diabetes is from fat intake. It gets in your muscles, inhibits your sugar absorption. It's fat, 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 fat. I hope you walk away. Fat causes diabetes, not sugar. Watch this video. It's great. If it's not an exclusive club, right? It's an all-inclusive club. Everybody can do this. It's about you and you taking the initiative to be the healthiest you can be, not some highfalutin thing. And it's not about quantity, right? It's about quality of life. Oh, who wants to live to be 100 and in a wheelchair for the last 20 years? I want to live to be 100 and have good quality of life, right? It's not about living longer, it's about living better. This is one of the oldest sets of twins. I think they're 113. High quality life. They're Okinawan, if I remember correctly, and eating mostly plant-based diet. Great stuff. I mean, this is so important to do it for you. And I'll leave you with this. I do like this. This is a picture I took a long time ago. I tell my patients this all the time. It does not matter how slowly you go as long as you do not stop. Keep going in the direction that's good for you, the healthier quality of life. Remember, do you really want to pay for my college education and my kids' education and my new car and my boat and all my skiing trips? Do you want to pay for that? Or do you want to take that money, keep it in your pocket, and then you do those things? So that's why I try to get it. Remember, you take care of yourself. You get to keep all that money. You don't, then you're paying me to do it in the whole sickness care system. So it's about you. You can do it. You really can. So Facebook, James Bennie MD, you can send me little messages there. I'm not the greatest at checking that, but I'll try to be better at that. I just really am that busy. It's hard for me in a busy day to get through that. I also comment on Nutritionfacts.org. I've been doing that for over 4 years with Dr. Greger. That is my icon, Fat McDonald. So you can always write me on his webpage too, and I will try to respond that way. And thank you very much. I appreciate your time.